Here we will talk about Aboriginal and Torres Strait Islanders population within regional areas. The 2016 Australian census showed that Aboriginal and Torres Strait Islanders population has increased over the years. There are estimates of 649,200 Indigenous Australian people in Australia. While the population size grows, the majority of them are living in regional areas. The figure on the right shows remoteness area of Australia. The pink color areas are considered to be inner regional areas, while grey color areas are considered to be outer regional areas. The Bureau of Statistics showed that 22% of all Aboriginal and Torres Strait Islander people live in inner regional areas, such as Orange and Bathurst, while 21.8% of them live in outer regional areas, such as Dubbo and Broken Hill. Between areas, there is a very significant difference in terms of health. The health report from Australian Institute of Health and Welfare suggests that Indigenous Australian population from regional areas are more likely to have early mortality compared to those who live in urban areas. Also, they are more likely to suffer a chronic disease. For example, they are 3 times more likely to be hospitalized for type 2 diabetes than urban areas. On the right bottom figure, it shows the prevalence of diabetes or high sugar level are much higher in outer regional areas compared to urban areas. For regional Indigenous Australian community, there are several types of health services available. General Practitioner or JP, they are used as primary healthcare services in regional areas because regional areas has less resources in their healthcare facility. JP is available for health assessment and medical care. Then we have Aboriginal Community Control Health Services. This is one of the essential health services to Indigenous Australian community, especially in regional areas. The services are operated by Indigenous Australian community and heavily rely on health care professionals with Aboriginal and Torres Strait Islander background, as they can understand the need of their community. There is also home care services, such as Health Care Home. You can provide personal care to patients with chronic disease by helping them manage their illnesses and taking the background into account. The regional areas also have preventative health services that aims to prevent disease or illnesses by early intervention or detection. One example of this type is government program Healthy for Life, which provide regular health checkup and immunization. It also covers maternity and child health in the community.
What is health promotion? Health promotion is referred as enhancing one's health and the process of empowering people to make decisions over their health. It is not just the obligation of healthcare providers, but also the responsibility of how people control their own well-being and lifestyle, according to World Health Organization 2018. Close the Gap is one of the far-reaching health promotion campaigns for Aboriginal and Torres Strait Islanders to improve their health. On the report of Australian Human Rights Commission 2018, the campaign's objective is to close expectation of life and health gap among non-Indigenous Australians and Aboriginal and Torres Strait Islanders. Its target is to present to the public the development in Aboriginal and Torres Strait Islanders' health. Why is health promotion significant to individuals or communities? According to Australian Government Department of the Prime Minister and Cabinet 2014, mortality and morbidity rate from potentially preventable conditions is higher to Aboriginal and Torres Strait Islanders than non-Indigenous Australians. Numerous Aboriginal and Torres Strait Islanders suffer from chronic disease such as diabetes mellitus. The image shows the expectations of life at birth for Indigenous and non-Indigenous males and females from the year 2010 to 2012. One of the leading causes of mortality of Aboriginal and Torres Strait Islanders is diabetes mellitus. Burrow and Ward, as cited in Australian Indigenous Health Infonet 2018, explained that Aboriginal and Torres Strait Islanders commonly experience diabetes mellitus with a higher percentage than the other people. From year 2012 to 2013, Aboriginal and Torres Strait Islanders are more probable to be hospitalized fourfold and 6 times greater number of mortality in 2013 because of diabetes than non-Indigenous Australians, as claimed by Burrow and Ward, as cited in Australian Indigenous Health Infonet 2018. Health promotion is indeed significant to Aboriginal and Torres Strait Islanders because of high prevalence rate to chronic diseases and shorter expectancy than non-Indigenous Australians. Enables them to maximize their access to healthcare services, such as by gaining adequate knowledge on how they can use available health services and awareness on how they can improve their health by properly addressing any healthcare issues they might encounter. Australian Government Department of the Prime Minister and Cabinet 2014 stated that Aboriginal and Torres Strait Islanders were anticipated to use health services more frequently than non-Indigenous Australians. Examples of health services available to Aboriginal and Torres Strait Islanders are as follows, according to Australian Institute of Health and Welfare 2016. First, access to primary health services relative to population distribution. It imparts help on decisions on policy and health services planning and identifies sectors where access is low. Second, use of Indigenous-specific primary healthcare services. It has been offered and controlled by emerging of primary health network services, Aboriginal community-controlled health organizations, state, territory, local health services, and other non-government organizations. Third, use of selected health services claimed through Medicare. Medicare data for 2013 to 2014 revealed that Indigenous Australians has applied for a claim through Medicare with an average rate of 6,115 general practitioner services per 1,000 population. Fourth, hospital services. Indigenous Australians has high percentage of hospital services usage, generally were in public hospitals. Access to services is an important factor which will positively impact on Aboriginal and Torres Strait Islanders' health. Who benefits from current healthcare policies and practices? Impacts of health services to health promotion of Aboriginal and Torres Strait Islanders with diabetes mellitus, according to Health Infonet 2018, includes: first, management and prevention of diabetes, a short-term projects for living healthily which are intended for Aboriginal and Torres Strait Islanders to avoid type 2 diabetes, enables beneficial outcome for up to 2 years and most likely to be successful if initiated by the society. Second, diabetes services and programs, primary healthcare services which are well controlled and culturally appropriate. Third, diabetes policies and strategies. Australian National Diabetes Strategy and the Diabetes Australia Action Plan emphasizes the necessity to attack diabetes in a national viewpoint. They advocate to focus on Aboriginal and Torres Strait Islanders people with culturally appropriate and comprehensive diabetes schemes. Access to services is an important factor which will positively impact on Aboriginal and Torres Strait Islanders' health. According to National Aboriginal Community Controlled Health Organization, 2018, policy of protection was enacted in the year 1837 after a decade of cruelty. There were certain policies and practices enacted in order to protect Aboriginal and Torres Strait Islanders and benefit from it. Australian Law Reform Commission 2014 recommended that Aboriginal people should have appointed missionaries, a defender to keep them from harm and to protect them through the special codes of law. Protectors were mostly nominated by executive order in New South Wales, Western Australia and South Australia, and the responsibility is to guard Aborigines from harm and to supply the remaining community around municipality with some medicine, rations, and blankets. Examples of laws regulated to protect Aboriginal and Torres Strait Islanders are as follows, according to the State of Queensland 2017. First, Aboriginal Cultural Heritage Act 2003. The purpose of this act is to bestow effective acknowledgement, conservation, and safety of Aboriginal and Torres Strait Islanders. Second, Aboriginal Land Act 1991. The focus of this act is to revise the Aboriginal Land Regulation 2011 to proclaim a portion of unoccupied state land as interchangeable land. Third, Family Responsibilities Commission Act 2008. The aims of this act are to assist the rehabilitation of regional supremacy in health rehabilitated community sectors and to give assistance to people in improvement of their well-being in community districts to continue primary duties for the well-being of their community, families, and individuals. The goals are attained primarily through the process of the Family Responsibilities Commission.
In this slide, we will be talking about the social determinants of health related to the development of diabetes in Indigenous Australians. Indigenous people of Australia has a higher risk of developing type 2 diabetes mellitus in their life. Healthy child development. Obesity is linked to the development of type 2 diabetes. According to Australian Bureau of Statistics, 60% of Aboriginal and Torres Strait Islander people aged 15 years and over who are either overweight or obese in correlation to their body mass index. Insufficient nutrition throughout early childhood can potentially lead to poor development of health. Taking this into consideration, the possibility of health concerns, for instance, diabetes, can be an outcome. Health practices and coping skills. Modifiable risk factors such as physical inactivity and insufficient vegetable intake increases the risk of developing this disease. In the 2012 and 2013 health survey done by Australian Bureau of Statistics, 3 out of 5 Aboriginal and Torres Strait Islander aged 18 years and over have inadequate daily exercise. In addition to insufficient daily vegetable and fruit intake, chronic health complications gradually progress over a period of time. Socioeconomic status. Various socioeconomic, geographical, and environmental factors can exert a major influence on an individual's key to a well-balanced diet. As food costs drastically culminate over a period of time, affordability becomes a key concern to consider. According to the Australian Bureau of Statistics, approximately 43% of Indigenous Australian adults had lower incomes in comparison to the 17% of non-Indigenous adults. Consequently, Indigenous Australians with lower income are more likely to have chronic health complications in comparison to non-Indigenous Australians. Furthermore, Indigenous Australians in most socio-economically deprived areas are more likely to have diabetes as opposed to the ones in advantaged areas. Health resources. Almost 5,000 Aboriginal people who lives in Dubbo. There is an expected rate of 200 to 750 Aboriginal people having diabetes, which shows the likelihood of many Aboriginal people who have undiagnosed diabetes or not supported by the local health services to manage diabetes. Type 2 diabetes is a chronic disease that requires constant monitoring and care. Access to primary health care is a significant factor in early detection, prevention, and management of chronic diseases. Aboriginal and Torres Strait Islander encounters barriers to health resources such as lack of transport, cost of services, and lack of cultural safety.
Showing respect for Aboriginal and Torres Strait Islander perspectives. The Australian Cultural Respect Framework defines cultural respect as the recognition, protection, and continued advancement of the inherent rights, cultures, and traditions of Aboriginal and Torres Strait Islander peoples. It shows that cultural respect is not confined to a human resource management or training. It involves the quality of care and equity of health outcomes that includes intersectoral action that will address the social determinants. There are strategies to achieve cultural respect for Aboriginal and Torres Strait Islander. First is employing Aboriginal staff. Second, having a culturally appropriate waiting room. Third, cultural awareness talks to staff. Fourth, promoting the service to the Aboriginal community. And fifth is the intersectoral collaboration. And there's another strategy to show respect for Aboriginal and Torres Strait Islander that should maintain. It should be having a good communication and awareness of cultural norms in the community of Aboriginal and Torres Strait Islander people. Working in consultation and partnership with the Aboriginal and Torres Strait Islander. Consultation with Aboriginal and Torres Strait Islander groups or communities is used to seek information, advice, opinion, and approval for a proposed action. They have 5 levels of engagement to consider in the terms of consultation, but it may not be fully representative of the perspective of Aboriginal Torres Strait Islander people. The first one is inform. It is important to provide information for Aboriginal and Torres Strait Islander peoples how the practice will identify and what are the health benefits or incentives they will get in the service. Next is consult. It is necessary to contact a local representative of the organization to provide appropriate information regarding the services to be implemented in the community. Third is involve. In this process, the practice might conduct a focus group of Aboriginal people that will help to determine how to improve programs for them. This process is responsible for any changes that might be happen while working in consultation and practices. Fourth is collaborate. It is an ongoing discussion about the program implementation from the practice to the community and could be a project that will provide cultural safety training to practice staff and enhance referrals to an Aboriginal and Torres Strait Islander health service. The last one is empower. They have control over the planning, implementation, and evaluation with the principle of self-determination, and the practice provides advice and service into this initiative. Communicating using appropriate verbal and nonverbal skills. Communication is a crucial thing for everyone when dealing with people. It is a key to form a good working relationship with others and serve as a tool in achieving productivity, output, improve morale and efficiency, and success. Most of Aboriginal and Torres Strait Islander people do not speak English as their first language, and it is important for us to consider their culture and traditions in terms of communication. Using personal space. For Aboriginal and Torres Strait Islander people, it is inappropriate for them to stand too close to a person that you are unfamiliar with or of the opposite gender, because it can make a person feel uncomfortable or threatened. Touch. We need to ask for permission and explain the reason why you need to touch them, so that we can establish rapport first, and then we can make them more comfortable. Silence. For Aboriginal and Torres Strait Islander people, extended periods of silence during conversations are considered the norm and valued and shows respect. Using eye contact. For them, avoidance of eye contact means a gesture of respect, but in Western society, averting gaze show as being dishonest, rude, or showing lack of interest. Avoid using complex words and jargon. Ask for clarification, paraphrasing to show understanding and request for feedback. Speak calmly and respect. Use diagrams, pictures, models, CDs, or DVDs to explain concepts, instructions, and terms. If required, seek help from local Aboriginal and Torres Strait Islander staff or interpreter, and use active listening. Understanding cultural protocols. By observing Aboriginal and Torres Strait Islander cultural protocols, in RACGP official and unofficial events, they are able to recognize and pay respect to Aboriginal and Torres Strait Islander peoples' cultures and heritage, communicate Aboriginal and Torres Strait Islander cultural practices to the broader community to promote respect and understanding, demonstrate that Aboriginal and Torres Strait Islander cultures are living through maintenance and practice of ceremonies and protocols, demonstrate the recognition of Aboriginal and Torres Strait Islander peoples' unique position, which can assist in building relationships and partnerships.
Australian Institute of Health and Welfare states that Indigenous Australians are more likely to suffer from chronic diseases such as type 2 diabetes. To fight against the growing prevalence of the disease, health promotion is an influential tool. Consequently, diabetes is a lifelong disease best managed with the help of health professionals and the support of community. Numerous services such as Healthcare Hub, which provides personal care to people with chronic diseases, and Healthy for Life program provide support, education, and management of type 2 diabetes.